that bag, see?
Oh, yeah.
Are you finished?
No, I got a little bit of retouching left to do. What time is the game today?
3.
Okay. I'll give you a yell when I'm finished, all right?
Okay, good. Hello? Oh, Judy. Yeah, we're going to the game. Jack's just got some more refinishing to do. We're about ready. Oh, I guess we'll leave here about 2:30. That all right with you? Fine. See you there. Okay, bye-bye.
Rita! Rita! Rita!
Jack!
Rita!
Oh, my God.
Rita!
Jack,
Rita!
don't move. Please,
Rita,
Jack.
put it out!
Hold still, please.
It is obvious that burns can be extremely serious. What caused the burn, how large of an area was burned, and what part of the body was burned determine just how serious a burn is. But the most important factor is how deeply the burn has penetrated. There are 3 layers of skin. First-degree burns are the mildest and only injure the surface layer of skin. A second-degree burn goes deeper into the underlayer of skin and usually is more painful. The most hazardous kind of burn is a third-degree one. Not only is skin destroyed, but muscles, blood vessels, nerves, even bone can be injured. First aid for burn victims varies according to the severity of the burn. Look at the burn carefully before you begin first aid. When you scald yourself, you may get a first-degree burn. On a person with light skin, it looks like a red or pink patch. It may not show on a person with dark skin. A mild sunburn is another example of a first-degree burn. A second-degree burn is more serious.
Oh! Oh!
Immerse the burn under cool, running water until the pain is reduced. Never apply ointments or household items such as butter, yogurt, or lotion on any kind of burn. They only promote infection and loss of body fluids. Gently blot the burn area with a sterile gauze pad. Usually it's not necessary to bandage a mild burn unless it covers a large area or there is a lot of swelling and blistering. If there is any break in the skin or the blisters are broken, do not use cold water, but apply a dry, sterile dressing and get immediate medical assistance. Be sure and check the burn area after a few hours. Sometimes blisters may appear later, and the burn may be deeper than you originally thought it was. Third-degree burns are the most serious. The skin is burned away, and the burn area appears white and raw, or even charred. Third-degree burns can result from contact with hot objects or flames or ignited clothing.
Jack! Jack, stay!
I'm going
Jack,
outside.
lie down. No, don't move.
Rita,
Jack,
put it out.
Lie still. I'm trying.
Rita.
Jack, hold still. Please lie down. Jack! Lie down, please.
When someone's clothing is on fire, make sure he doesn't run. Running only increases the chance that the flames will reach the neck and head. Smother the flames with a blanket or even a coat, or have the victim roll on the ground.
Lie still.
Do not put water on a burn of this type. Instead, cover the burn with a thick, dry, sterile dressing and bandage. You can even use a clean sheet. Don't try to remove clothing that has adhered to the burn. Just place the dressing right over it. For burns covering small areas, place a cold pack over the dressing. You can make one by putting ice cubes in several layers of plastic bags. It's important not to let the ice touch the burn directly. With burns to legs or arms, have the victim lie down and elevate the burned area if it does not cause pain. Treat the victim for shock and get medical help as quickly as possible.
Lie still. I'm going to call 911. Help, there's been an accident. My husband's been burned.
If the victim has face burns, make sure that the head and shoulders are propped up. and keep the victim under continuous observation for breathing difficulties. If a breathing problem arises, an open airway must be maintained. And remember to treat the victim for shock. And again, it's important to call for help and get the victim to the hospital as quickly as possible. Third-degree burns, as well as extensive first and second-degree burns, inevitably lead to infection, loss of body fluids, and shock. If quick and effective medical aid is not given, the victim may die. It is not always easy to tell how serious a burn is, however. For example, blistering and swelling may be delayed. Don't use pain as a criterion for treatment. Oftentimes, a second-degree burn can be more painful than a third-degree burn. With third-degree burns, nerve damage could be so extensive that the victim may not feel much pain. Some victims, such as this one, have combination burns, with some areas of first-degree burn and other areas that are burned more deeply. Always base your decision about first aid on the worst burn. Most burns that we see here are caused by exposure to heat, but serious burn can result from exposure to caustic chemicals as well.
Hey, Ralph, how you doing? Okay.
John.
Yeah.
I'll meet you outside. Gotta go by the office for a few minutes.
Okay.
I'll see you by the car.
All right, super. Whoa!
What happened?
My leg.
Let me give you a hand.
If a strong chemical gets on the skin, wash it off immediately. As long as the chemical remains on the skin, the burning will continue. Chemical burns are as serious as heat burns. First, second, and third-degree burns are all possible from chemicals. Be sure to remove all clothing on which a chemical has spilled, especially clothing touching the burn. Flood the affected area with running water for at least 5 minutes. If no running water is available, use a bucket or other container. Just pour as much water as you can over the area. Don't scrub or use soap. Once the burn area has been sufficiently washed with water, cover with a dry, clean, or sterile bandage. If the chemical container gives first aid directions for burns, follow those after the initial flushing with water. Call for emergency medical attention immediately. If there's been a chemical burn of the eye, flush the eye out immediately with running water from the inner corner outward. Keep the eye open. You may have to hold the lid open like this. If only one eye is involved, turn the head so that the burned eye is closer to the ground. If the victim is wearing contact lenses, give assistance in removing them before flushing out the eye. Call for professional help, but in the meantime, continue to wash the eye out for at least 5 minutes in the case of an acid burn, and at least 15 minutes in the case of an alkaline burn caused by such substances as strong household cleaners. Then, cover the eye or eyes with a clean or sterile dry bandage. Though many burn accidents are industrial, most burns result from accidents in the home. Remember, treat mild burns by submerging the burn area in cool water until the pain is reduced. Then dry the burn with a sterile gauze pad. Usually, mild burns do not need medical attention, but be sure to check the burn after several hours to see whether blistering and swelling have developed. If so, the burn is more serious than you thought at first. Serious second-degree burns and all third-degree burns are usually accompanied by blisters and areas where the skin is white or burned away. Do not put water on a burn of this type, or any kind of lotion, butter, or ointment, and be careful not to break the blisters. If any clothing adheres to the burn, don't remove it. Instead, cover the area with a dry, sterile bandage. Then place a well-insulated cold pack over the bandage. This will help to reduce the pain. The procedure for treating chemical burns is different than for heat burns. With any chemical burn, always rinse the area with water and remove any clothing that has the chemical on it. Rinse the burn for at least 5 minutes. If any chemical has gotten into the eyes, flush them with running water for at least 5 minutes in the case of an acid burn or 15 minutes for an alkaline burn. Then bandage with a dry, sterile dressing. All these measures can help the burn victim be comfortable and reduce the chance of infection and shock. But with any serious burn, it is imperative to get medical aid as quickly as possible. Without medical attention, severe burns can never heal.
How you doing, hon?
Okay. Just hurts a lot.
Must be them.
Well, I guess we won't make the games, do you?
I guess not.